Hi, hello. We are now going to talk about seizures, right? Have you ever heard about seizures, but they're not really seizures? Today we are going to talk about psychogenic non-epileptic seizures, or it's called as PNES. We are going to untangle this fascinating mind-body connection. It's pretty complex. It's something that can really impact people's lives. So we're going to talk about the causes, the characteristics, and the challenging of living with this condition. What are these, what is this PNES? Imagine sudden loss of consciousness and you have tremors and the person becomes unresponsive. It must pretty much look like a seizure, but the crucial thing is the triggers. It's not an abnormal brain activity. It's more of a psychological, emotional. The mind is what is causing these seizures. That's a great way to differentiate. It could be a whole range of stress, like trauma, extreme stress, anxiety, depression, PTSD, post-traumatic stress disorder, right? And then can be like a less common, like fictitious disorder. So if I really look at like somatization disorder, it's a mental or emotional distress manifests as physical symptoms. That's called somatization disorder. So your mind stresses, your body shows some symptoms, even though there is no bodily anything wrong. Fictitious disorder is when one intentionally creates and exaggerates symptoms, but not for any obvious external gain. So faking an illness to take off from work, that's not what it is. Factitious is like there is a deeper psychological need. There's very real, very physical, symptoms of seizures, but there is no, major brain seizure activity. So it impacts on their emotional well-being, interpersonal relationships. Imagine trying to explain this to a new partner. Why do you collapse? Even though, it's a lot of misunderstanding. Even though they like you and they love you. What kind of emotional struggle do people with PNES go through? There's a constant anxiety and they don't know when the next episode is going to happen. It's like waiting for the other shoe to drop. So it's not having any control over your own body. And then there's often this feeling of guilt or shame because they know the root of the problem is psychological. And they are like being blamed for something that's beyond their control. It should be like really so tough to really navigate the relationship. It'll be received and perceived as mental, so the loved ones who doesn't understand, and you can feel so isolated, difficulty maintaining a job when they go through a physical exertion or consistency. There's a lot to go through. There's also cognitive impacts. How does PNES affect the cognition? It can cause memory problems, brain fog, difficulty concentrating. I can only imagine how much harder it makes day-to-day life. Even to follow the simple recipe or follow the commands can become very difficult. PNES is a complex condition. There are so many aspects of life that gets affected. What does this all mean to someone who is trying to manage and live with this PNES? That's where it gets pretty complicated. There are so many practical challenges. Navigating daily routines, like when you're worried about having a seizure. Maintaining independence when you feel that you're unreliable. Dealing with financial stress by job loss or medical bills. And also the whole hurdle of getting appropriate medical help. It can be really challenging, but there is hope. The first step is to understand the complexity of PNES and then seeking the appropriate medical and therapeutic support. Therapy is often crucial. The CBT, the cognitive behavioral therapy, And that will be very helpful to identify the emotional triggers. The trauma work is quite an important thing. Medication might be, very important to, really treat the underlying depression, anxiety. So you're really working on the root cause. So there are support groups, there are online communities. They will be very, very invaluable, incredibly useful for people who are living with this PNES. It'll make you feel like less alone, more empowered. Thankfully, the awareness of PNES is growing, which is so important for breaking down that stigma and fostering the more supportive environment. And this is such an eye-opening topic for us to really, bring awareness. The PNS is a powerful reminder of the connection between our mind and our bodies. It's a link that we'll all benefit from exploring further, regardless of whether you are personally affected by PNES. If you are someone who's really struggling with PNES, and if you don't have the clear neurological cause, please seek help. Epilepsy Foundation is a great resource. They can help with diagnosis and treatment. Remember, understanding is the first step for us seeking help. Thank you for listening to my talk today. And on that note, please, if you or your loved ones or someone that you ran into are suffering from this PNES, to encourage them, give them your empathetic ears, and don't say it. It's all psychological. It's so easy for us to rub it off. But can you be in their shoes for a second? And, be empathetic, and me being non-judgmental is everything. There is help. And the underlying root cause needs to be addressed. And once they do that via therapy and medication management, they can have a wonderful life. And there is hope. On that note, bye-bye.